is that the Lovenox was deceased. So
yeah, but the Lovenox was on hold because of the clot. He has a little bit hemorrhage on his head. My name is Clemine Privat. I work in ICU at Westside Regional. I've been a nurse almost 2 years, and it's which I enjoy every day. To be a nurse, you have to have patience, but unfortunately, sometimes we lose it. But you have to have patience. You have to be able to communicate. You have to be able to understand the meaning of the patient, what they mean, what they're here for, what's going on with them. You have to, the main key for me, patient, you have to have compassion. Compassion is the most important key. Not the lack of patience. It's not good, especially when you're dealing with critical care patient, because if you don't do it, something can happen. You have to be able to slow down, to think what you're doing. It's going to be good for the patient? If it's not good, because any mistakes, if you're not patient, you can make any mistake. And unfortunately, in this field, we find that we tend to make a lot, not intentionally, not intentionally, it happens. So you have to have a lot of patience, especially when you're dealing with medication. You have to verify, you have to double check. If you're not sure about something, you have to call the doctor. Sometimes the doctors write an order, you don't understand it, you have to call him and verify with him. So if you're in a rush all the time, you have to slow down. You have to say, look, okay, I got to slow down. I have to be patient. I've always tell someone, to be in this field, to be a nurse, you have to say to yourself, is that really what I want to do? Do I need to be a nurse? And every day you're going to find different cases. It's different every day. And don't do it just because, you hear the money. I mean, I can tell you it's a good career. You have a job stability. The job stability it's good, but you have to have some compassion in you. You have to be able to want it.
My name is Anna Lugo, and I am a registered nurse. Well, patience would be defined as taking the time to listen to the people around me, whether it's any type of coworker, patient, visitor, physician, any of my customers, and give them the time of day. There has been many situations where you will become impatient, and what you have to do is remove yourself from the situation. You excuse very politely from the situation. You gather yourself, you compose yourself. If you need to go into the bathroom and yell a little bit, that's what you do. And then once you've, regrouped yourself, then you come back and you have a better outlook as to how you will handle the situation and continue to be patient with whatever the situation is. Sometimes being too patient is perceived by some patients or visitors as you thinking that they are dumb. So that, there's got to be a happy medium. You cannot be too patient or not patient at all. Everything in life has to have a balance, and you have to find the middle of it. When you have an inpatient employee, it can affect the hospital because the patient is going to rate the hospital in the HCAHPS survey low with a 1 or a 2 instead of a 5, and that will decrease the funding that they get from the government because of the Medicare, because it's all based on the HCAHPS scores. So it will affect the hospital financially, and also financially that patient might not come back to receive care in the hospital. So that's one more patient that you lose for the future, or one more referral, because then the work gets done in the community. People talk to each other. Oh, I went to Memorial West, it was a wonderful experience. Well, that neighbor's going to go there. If they say bad things, then they might not, come back or want to go there, because, there's a lot of other hospitals around.
Tiffany. I've been working here for 2 weeks. And this is my second career, and I love nursing. We see people at their worst. So it's not like Disney World where you work there and you're seeing everybody who's there is happy and they're on vacation. We're seeing people when they're sick, always. So if they're here, they're usually sick, they have a test, they have something that's wrong with them. So they're very anxious, their family members are anxious, and everybody wants to know what's going on at one time. So basically we have to remain confident, we have to remain patient, and we have to try to remain patient with the patient as well as their family members, but sometimes it can become overbearing.
I'm going to do an assessment from head to toe, and then I'm going to discuss the plan of care for today. I'm going to review the orders for the doctor. Hi, my name is Charlene Rivera. I've been a nurse since December 2003, and I used to be a nursing aide, and I was going to school to become an ultrasound technician when I developed the passion to take care of patients more deeply. Being patient benefits the nurses in a lot of ways. You don't get frustrated at your job, things are done properly, you don't make mistakes, and the patient feels secure because at that time they expect that you're gonna be there at every moment. They don't care if you have 2, 3, 4, 5 patients. And when the patient go home, when it gets better, they'll pass it on to their neighbors and their friends and said, "Oh my God, the nurses were great at this place." And of course, when the other people get sick, they want to come to your hospital because word by mouth, they like you, you do a good job, they come back, and the hospital keeps busy, so you keep a job.
My name is Angela Vila, and I'm the clinical educator and supervisor at Aventura Hospital Emergency Room. If you're working in emergency medicine, you're always under a lot of stress. You're always dealing with patients, and you're dealing with coworkers, and you know, you want things now, and to move, and so do your patients. And some patients that we work with are very demanding. They don't want to understand, they don't want to listen, they want what they want. And I had this one situation with a lady didn't want to go upstairs if it wasn't a private room, and didn't want to hear what I had to say. So at that point, I'll step away, and I'll get a fellow colleague to come in there with me and kind of double team, you know, to convince the person to talk about it. In situations, the nurse kind of sometimes has to be calm, cool and collective, because if the patient kind of sees that you're distraught or you're nervous or anxious yourself, then they sometimes can lose confidence. For instance, I'll give you an example, emergency delivery. I had, you know, the mother's going hysterical, the father's hysterical, and the rest of the family are hysterical. But I, as the individual, the only nurse being there and the baby's coming out, have to be calm, cool, collective, and portray that to the patient. Okay, you know what, Mom? You're having the baby now. We're going to have a baby. We're going to just listen to me, follow me. You build that confidence with that patient, and you have to stay cool. I think someone who is patient gets a lot further as far as working with people, communicating with people. If they learn how to be patient and not like a hothead, you know, they're not going to be in constant arguments with people, because if you just lose your temper all the time, you know, you're really going to wind up hating working where you are. You're going to have enemies as far as your co-workers and colleagues, and you're just not going to be happy because people don't want to work with you, and you don't want to work in the facility. And you know, so having patience with a lot of things, it's definitely beneficial for you and for the facility where you work at. Lack of patience is basically living in stress. I mean, you will always be living in stress, because if you don't have patience with your patient itself, your patient's gonna look at you as probably you're a bad nurse, you're rude, you know, you're not meeting their needs, and also your environment's gonna be probably very negative. As far as when we're talking about being patient, you have to have, that's a characteristic that you just have to have when you're dealing with the sick.